Good afternoon, and thank you for joining today and helping us launch the American Cancer Society 2022 League of Heroes of Ohio, presented by United Healthcare. My name is Marianela Napolitano, and I am thrilled to be with all of you today. I am a regional director with United Healthcare, and I am also a dedicated and passionate volunteer with the American Cancer Society. During today's program, we would like to introduce you to the H.E.R.O initiative. H.E.R.O stands for Health Equity Research and Operations. And more specifically, we would like to introduce you to the League of H.E.R.O campaign, which funds this critical work. And soon, we'll hear from some community leaders around the topic of health equity. Cancer affects 1 in 3 Americans, but we know that cancer does not affect everyone equally. Racism, classism, and discrimination hinder the pursuit of long and healthy lives. At ACS, we believe that everyone should have a fair and just chance to battle cancer, no matter who they are or where they come from. And that's why we're launching the H.E.R.O initiative, to fight for health equity for our most vulnerable communities. Shortly, I will turn things over to Sarah Wells. Sarah is the Vice President for Ohio and West Virginia with the American Cancer Society, and she will guide us through a conversation around the topic of health equity with 2 passionate community leaders. She is joined by our campaign Executive Chair, Dr. Srinivas Murugu, Chief Medical Officer and Vice President of Population Health at United Healthcare, and Dr. Saran Kurukian, ACS-funded health equity researcher. Fighting for health equity in the cancer space is the battle of our lifetime, and we are calling on local heroes to help us continue our fight. Take a look.
In 1966, Martin Luther King said, "Of all forms of inequality, injustice in healthcare is the most shocking and inhumane."
I don't want another 50 years to go and we still talking about the same issue, an issue that can be resolved.
In our fight for a world without cancer, it's clear that the fight is not a fair one.
There's a lot of research that shows that someone's zip code can be more important than their genetic code.
There's no equity in health. It's the haves and the have-nots.
What does equity look like? It's all people having the same outcomes.
I feel like it's more systematic barriers that we were placed in that would give us those inequalities of healthcare.
Despite all the different diverse things that impact each patient uniquely, they all have one common thing. They're trying to beat cancer.
You know you're in for a fight for your life.
I needed someone to follow to get me through this journey, because it's a journey, and the journey doesn't stop. In the American Cancer Society, they help you with a lot.
We invest in the American Cancer Society because of the great work that they do. Health equity is extremely important and vital to our work as well, and so really our missions align very closely.
Solutions around cancer-related inequities require thinking outside the box. It takes a village to resolve these issues.
Most of it really does come down to socioeconomic, so it's all cultures, it's all people.
Some of these populations are almost invisible. And that's one of the reasons why I believe they continue to be under-resourced.
Myself, I'm from a rural community, so we are definitely underrepresented in the fact that we have 1 2-story hospital, and it's got like 2 doctors, and we have to drive to Lexington for pretty much everything.
Nobody benefits from having under-resourced communities in a society. It affects all of us.
Addressing the unequal burden of cancer in all populations has been a core priority for the American Cancer Society for decades, but now we are taking it to the next level.
They're saying, aquí estamos para ustedes. Nosotros los apoyamos. We are here for you. We are recognizing your strength. We're recognizing the fact that you're more courageous than you ever thought you could be, and we will be here to carry you through.
The American Cancer Society is doing so much to raise awareness, and so very grateful because we're having such important conversations about this. This is how we create change. This is how we do something really radically different and change the game with cancer in these communities.
And today we're asking you to join us. No need for superpowers, alter egos, or capes. Just the courage and the will to do what's right.
Thank you, Marinella. And wow, what an impactful video to showcase why this work is so important. I'm Sarah Wells, Vice President with the American Cancer Society, and I'm honored to be here with all of you today to launch our League of Heroes campaign. At the American Cancer Society, we are not new to the fight for health equity. We have funded more than 550 grants, totaling more than 300 million in health equity research. We implement cancer control interventions and partner with community organizations and coalitions to reduce disparities and increase access to care. And we advocate to advance local, state, and federal policies that break down existing barriers. As Marinella explained, the HERO Initiative is our commitment to continue this work. The American Cancer Society is working hard to ensure we see a reduction in cancer death rates by 40% across the country by the year 2035. But to make that vision a reality, we must focus on communities that experience greater disparities in cancer diagnosis and survival. As Marinella mentioned, I have the pleasure of sitting down today with Dr. Marugu and Dr. Karukian to discuss their work, their passion for equity in cancer care, and more about how you can get involved. Dr. Marugu, I'm happy to have you with us today and so grateful for your commitment as our 2022 Ohio League of Heroes Executive Chair. Do you mind starting the conversation today by sharing a little bit more about yourself and why this work is so important to you?
Yes, thank you, Sarah. Thank you so much for inviting me and really for this opportunity to be part of this much needed and really meaningful effort. I truly believe that work like this is so central to our shared goal of promoting health and wellness in America and giving everyone a fair chance to achieve their full potential and also their life goals. Since I'm a primary care doc by training, an internist, and since my days in practice as a primary care physician in Cleveland, screening for cancer with the intent of prevention, early diagnosis, treatment, and cure, it's always been central, not just to my practice, but also to my personal mission. Marinella pointed this out in her comments. Cancer affects about a third of the population in America. And disparities, whether they're based on social, economic, racial, or geographic characteristics, are really pronounced in cancer. And to be candid, they are really unacceptable. I think the American Cancer Society has played such a key role in promoting awareness and delivery of these services. I appreciated it when I was a physician in practice. I've been with United Healthcare for just about 7 years now. And I tell you that I watch your efforts. I use the material that's produced by ACS on a regular basis. And I'm really looking forward to playing a part in this campaign. Thank you, Sarah.
Well, thank you again for your commitment to join us. As we know, we can't win this battle. We can't do it alone. And so it's critical to have partners like you and United Healthcare. So thank you so much. Your support of this campaign is helping us to fund critical research to help us better understand disparities and how we can address them. At the American Cancer Society, we currently have over 59 grants and more than $50 million right now invested in health equity research, which is huge, and thrilled to say that. And we're so proud to fund the important work like that of Dr. Karukian's, who's also joining us today. So welcome, Dr. Karukian. Thrilled to have you here as well. And love to hear a little bit more about your work and how the American Cancer Society has played a role in your career, Dr. Karukian.
Thank you, Sarah, and thank you, Dr. Merugo. What an honor to be here with the two of you and discuss this very important mission. So the ACS has really helped me to develop a research portfolio that revolves around areas of program and policies and cancer disparities. And I'm currently working on 2 projects funded by the American Cancer Society. One of them we're about to wrap up, and it uses real-world data by Flatiron Health to look at disparities in genomic testing and also targeted therapy in patients with metastatic colorectal cancer. And another study that we are actively pursuing is looking at the impact of Medicaid expansion on cancer outcomes. Of course, you know that Medicaid expansion was really a very much of a welcomed development in the world of policy and how it improved access to care. And so we would like to really evaluate its impact and unravel mechanisms by which it works. So we're very passionate about that work, and we're using some really novel data resources and techniques to understand these mechanisms.
Well, excellent. And you shared a little bit about it, Dr. Karukian, but can you take it a step further and share how your work aims to address and uncover disparities in access to care and ultimately cancer outcomes?
Yes, so what's really interesting with our work on Medicaid is that people think Medicaid is Medicaid. Everybody on Medicaid is the same. And in fact, the Medicaid population is very heterogeneous. There are people who have been on Medicaid for some time. And yes, they have very complex healthcare needs, be it physical or mental, et cetera, or disabilities. And then there are people who come to Medicaid as they're diagnosed with a catastrophic illness like cancer. That group, the latter group, and we call them the newly enrolled, these people are diagnosed at a much higher rate with late-stage disease. Why? Because they have not had any access to care, and then all of a sudden they discover a lump in their breast or something goes very wrong, and they go to seek care, and somebody says, you need to have surgery or whatever test right away. And the person says, but I don't know where to go. I don't have insurance. And somebody might say, you might be eligible for Medicaid, and that's how they get into Medicaid. So we are in the process of analyzing that mechanism, but we think our data show, not we think, but our data show that one mechanism by which Medicaid expansion has worked is that it has really reduced the group of people who come to Medicaid as they're diagnosed with cancer. And if they've been on Medicaid for a while, then they've had a chance to maybe get screened, maybe get counseled for screening, and so on and so forth. So that's a really important thing. And also, I would like to take this opportunity to also talk about the breast and cervical cancer early detection program, a very, very important program. And it really works magic because, in so many circles, you hear, let's improve access to screening. Okay, so let's say that a woman has a mammogram and then there are abnormal findings. What do? You say, well, you need additional testing, but she may be underinsured or uninsured. But what the BCCP program does is it covers the diagnostic testing and it navigates the patient through. And then if she is diagnosed with cancer, then she's automatically enrolled in the Medicaid program. So our earlier study looked at the BCCP program, and it's an amazing program. And it's my wish. This is my own passion to see that kind of program really implemented in many segments of cancer prevention and control programs. We cannot just ask people to get screened. We need to have the kind of infrastructure to support them to go forward with their diagnostic testing and treatment, follow-up, and everything else.
Absolutely. And the American Cancer Society Action Network has been a big part of
Yes.
advocating to ensure that funding for the BCCP program is there. And I'm thrilled that we've been diligent about that throughout the years. So thank you for that. No one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, their gender identity, or their disability status, or where they live. But unfortunately, we do know that these inequities exist. And for instance, Black women are 40% more likely to die of breast cancer than white women. And only 3% of oncologists are located in rural areas, making access to care that much more of a barrier for these communities. So Dr. Murugu, as we launch this local campaign, can you share an example of how social determinants of health could impact someone seeking cancer care based on your experience?
Of course. Yes, Sarah. Both Dr. Kurukian and you've highlighted some very distressing statistics and facts. And I really think these are the things that need to propel us into action. The main thing that we need to recognize, and I think most of us do who are involved in this work, is that behind these stats are real people. These are our neighbors, they're our friends, they're our family, they're members of our community, whether they are new immigrants to America, whether they're folks who have lived their entire lives, multi-generations in America. Whether or not we know them, interact with them, these are all members of our community. And in my days in practice, I saw so many patients come in with advanced cancers, the likes of which I never thought I would encounter in America. I trained in India. I was not a stranger to seeing cancers in really advanced stages because someone had waited too long, just because they lacked the knowledge, they lacked the resources, they lacked access to good care. Here in the United States, and especially in a state like Ohio, where some of the most well-regarded healthcare institutions and providers in the world are located, it's always so jarring to see this. I've seen members on my plan, I've seen patients when I was in practice, women, young women, not having had a pap smear, ending up dying in their 40s after terrible suffering from cervical cancer. Men who are in their 50s who couldn't take time off from work, didn't have the comfort, the information they needed to get their colon cancer testing done, not having the screening done, now having multiple surgeries, having chemotherapy and undergoing suffering at a very early, young, and productive age in their life. These are very real people that I've come across, and I still continue to encounter them every day in my current role. When we talk about social determinants, I think that it really depends to a certain extent on where we live. If you're in a large urban center like Cleveland or in Akron, let's say, it's oftentimes the challenge of managing several jobs. It's a matter of protecting your income to take care of your family, the inability to find time to make and keep these appointments. Those are the big social determinants often. Once you start moving out of these urban centers, like you pointed out, the stat about oncologists not being in rural areas, only 3% of them are there. You're talking now about those more rural dispersed areas. In addition to all of these challenges that you have in the urban area, now you can add on issues related to access to a clinic or a healthcare professional even, who can educate you, who can guide you, who can perform these services. These are all real barriers people are facing. There's not enough money to put food on the table for your family. There's not enough money to pay rent for your family. These are real issues that are getting in the way of folks accessing. Even if it's available, even if that care is available and right around the corner, they still can't access. Now, on top of that, when you start layering things like race and language-related barriers, we can all see how this gets exponentially worse for some members of our community. So to me, it's really, in a way, it's not surprising. It's very distressing, but at the same time, it's not surprising that there are so many disparities, some of which you have already mentioned, Sarah.
Absolutely. Well, thank you for that, Dr. Murugu. And Dr. Kurukian, I'll ask you the same question. Can you share an example of how social determinants of health could impact someone seeking cancer care based on your research and work?
So we just recently published a paper looking at the characteristics of counties where we find really high rates of late-stage breast cancer diagnosis. And these counties were had low mammogram rates, of course, but also high uninsured rates. They were high area deprivation counties and also high poverty. So time and again in our studies, we see the impact of social determinants of health. But I'm going to paraphrase something that I heard at a conference. We were having the Cancer Disparities Symposium here at Case Comprehensive Cancer Center. And at the very end of all the presentations, we opened up the conversation to have a town hall kind of discussion. And one of the ladies said something that I'll never forget. She said, "You all are asking me to go get my mammogram. My priority today is to see my son come home without a bullet in his chest." And when this is the reality in which people live day in and day out, you know, we're not even talking about the microaggression. We're not even talking about the poverty, you know, all of these difficulties, but that fear, that paralyzing fear, is my child going to be okay, you know, given all the violence, all the racism and everything else happening. And then for us to turn around and say, you know, we really wish you could get your mammogram soon. It just not, you know, and I think that's the kind of reality that we need to really come to face. And what can we do? How can we address this? I think that's really the most important question.
And so critical for us to address. So thank you for that. As we prepare to launch this League of Heroes campaign and expand upon this critical and important work, can you both speak to why this work is so important, so critical right now in today's world?
Maybe I'll let Dr. Krukian respond to this first.
Yeah, great, thanks.
Well, I just think that we need to join hands. You know, this is not a battle that one single person can win. And you know, we talked earlier about this being, you know, taking a village to really overcome these issues. And it is so important. You know, we need the bench researchers, you need the social scientists, we need the social workers, we need the primary care physicians. Such a critical role you all play in cancer prevention and control. So unless we really join hands, this is not going to happen, which is why you know, all of us here are so passionate about launching such a campaign and saying, let's get together and see how we can tackle these issues.
Yeah, I would really echo everything that Dr. Krukian just said. To emphasize maybe just a few things, I think this is a time where we have awareness, we have knowledge, we have statistics. The facts are undeniable. We have resources within our reach, and therefore I think equity is possible. This is an entirely avoidable and remediable situation. It takes will and courage to act. I think to think deeply about which systemic and structural policies and actions it will take to change. I think we need to act at an individual level. That's really, really important. Every one of us has a role to play in this. But in addition, I think organizations, small and big, and leaders in all spheres, we must commit ourselves to this. Standing on the bylines to me means nothing more than continuing to tolerate suffering for our communities when we could really be alleviating it through our actions. So standing by and watching these stats anymore is really not acceptable. So that's the reason I agreed to, and I'm glad to be part of the campaign. But then it's inspiring to see the work of researchers like Dr. Krukian, organizations like ACS. I feel like we have everything we need now. We just need to act on it.
Well, I agree so much with both of what you said, and agree we can't do this alone. We know the American Cancer Society can't do it alone. And we're thrilled to have partners like United Healthcare and like the two of you, the advocates in both of you, that are out there working alongside of us, because that's the only way we're going to be successful in this battle. And so I think that's why we're all here to share on the League of Heroes and launch this critical campaign, calling on local heroes to help fund this critical work. We need to raise more dollars. We know that the American Cancer Society has done some incredible work along with partners over the years focused in health equity, but we need to do more. And so we're calling on local heroes to help fund this critical work through our 2022 Ohio League of Heroes campaign. Again, graciously sponsored by United Healthcare. Dr. Marugu, we thank you for your generous support on behalf of United Healthcare, your executive leadership, and the presenting sponsor by United Healthcare to launch this campaign to fund critical research and programs. Again, thank you so much. We couldn't do it without advocates like the two of you alongside us and critical partners like United Healthcare. So Dr. Marugu, could you share why, I think you did obviously personally yourself, but why to an organization like United Healthcare is this work so critically important and such a priority?
Sure. Yes, Sarah. So once again, first, I want to thank you for inviting me to be part of this effort. I think in the past few years that I've been part of United Healthcare, we as an organization have been diligently looking at all the data that's available to us. We work with government, provider, and private sector partners. We are leaders at all levels of the organization. We are working with leaders. We are working with grassroots organizations all across the country, primarily to understand the root causes of many of the challenges we are confronting every day, particularly in, again, we are specifically talking about cancer here. But as an organization with a national and international presence, and one that we are trusted by so many people to help our people live healthier lives and to make the healthcare system work better for everyone, we are taking this role and responsibility in promoting equity very seriously. I think it's that we not only do we care, we are also able to play an active role in this work. So we clearly recognize and acknowledge that it is through commitments to campaigns like this one and engagement at all levels of the health system that we are going to be able to achieve our shared vision for a more equitable healthcare system and better health for everyone. So that's what's motivating me personally, and that's really what's motivating our support of ACS and any investments we are making in this campaign as well.
Excellent. Well, again, we're so thrilled to have your leadership. Marinella has been such a strong advocate and leader for us, and thrilled for the new partnership with United Healthcare focused on this League of Heroes campaign and the important work we're doing focused in health equity. So thank you again. And thank you to our supporting sponsors. We could not move this work forward without your support and leadership. So thank you for being a part of this enhanced focus on health equity and ensuring that all have access to cancer care no matter what. And speaking of leadership, Dr. Karukian, you're not only a tremendous advocate for health equity, you have also committed to help us raise funds for this year as a participant of our Ohio League of Heroes campaign. So wondering if you could share a little bit about your commitment, what it means to you, and to be a part of this work.
You know, thank you for the opportunity to share my thoughts. I really wanted to share this with you. Again, it's the passion. It's really the desire to see equity in our society. And today is a very something very poignant happened. Dr. Paul Farmer, whom some of you may know, he was a giant in global health, promoting equity around the globe, and he passed away yesterday. And so I was going through some of his videos, and there was a video that was on CNN, and there are some snippets that I would like to share on this video, if that's okay. It says, "Beyond mountains, there are mountains." And so there are lots of obstacles. You can overcome one obstacle, but then you need to be ready for the fact that there's another obstacle, and then there's another obstacle. So that, Sanjay Gupta was talking about all this, and then he interviews Paul Farmer, and Paul Farmer said something really touching. He said, if, the question is not, can we do it? I think, if NASA had said, can we do it? We would have never been on the moon, but the question is, how can we do it? And we're all here committed to that question. How can we do it? And I think, we all share the passion. We are committed to this to the extent that we can, to launch this very important campaign. And it's all fueled by our passion and commitment to end equity. How can we do it?
Absolutely. Well, thank you for that. And I hope others joining us today feel that passion and want to get involved. We're grateful for your commitment as one of our local heroes and your continued support, encouraging others to join us in this fight. We are calling on all local heroes to engage with us in this important work. If you're listening today and you want to get more involved, please reach out to me at sarah.wells@cancer.org or to our lead staff member driving this campaign from the ACS side, Haley Dorflinger at haley.dorflinger@cancer.org. And just thank you for being with us today. Thank you, Dr. Marugu. Thank you, Dr. Karukian. Your leadership out there, being incredible advocates, both in your professional and personal lives, on the importance of this work. Again, we spoke to it throughout the program today, but we know how critically important it is to continue to fight these inequities and ensure that these inequities don't exist as we move forward. And we couldn't do it without partners like United Healthcare and like the two of you. So thank you for joining me today. Thrilled to be launching our 2022 Ohio League of Heroes campaign. And I hope you all have a wonderful rest of the day.